Good afternoon and welcome to Culture, Care and Data, a discussion hosted by Feelgood and HCA Healthcare, where we are going to explore the next era of mental health demands and support in the workplace. My name is Jill Williams and I'm an organisational psychologist with Feelgood with close to 20 years building healthy cultures and looking at wellbeing and mental health in the workplace. What we've seen over the last 5 or 6 years is that we've made tremendous leaps in the space of mental health at work. It's no longer a peripheral conversation. Stigma has started to reduce, absolutely not gone. And organizations are thinking more about how do we really build mental health strategies into our business strategy and think about both supporting our employees, but also preventing risk in the workplace. But given that, what we're also seeing is that data from HCA shows that the leading cause of occupational health referrals is psychological. And data from Howden's global survey looks at the fact that what we tend to see is that the leading cost of claims is going to be mental health in 2026. Plus, we know the landscape that we're operating in, that there is so much information out there for people to go and self-diagnose based on what they see on social media or other avenues as well, which is definitely having an impact. So we're in this interesting point of time where the role of an employer is coming into question. What do organizations really need to do to support their employees with their mental health? It's an opportunity to get back to robust, evidence-based practice, think about the unique position that organizations have to help people access the care they need, and to think about workplace strategies for reducing risk, providing recovery, and helping everybody who needs it. And that's what we're very much here to talk about today. And I'm delighted to be having this conversation with 3 people who have got lots to offer here. So we've got voices from HCA, from Howden and from BNP Paribas. And I'd like to turn to my guests to give them an opportunity to introduce themselves first. Simon, I'll come to you.
Thank you, Jill. My name's Simon Brits. I'm a counselling psychologist with HCA Healthcare. And I guess I straddled an interesting world. One day my job would be to see 6 clients. And these are our colleagues and our employees in terms of day-to-day psychotherapy that we'd be doing. And then the next day, I guess I sit with wellbeing strategists. I sit with HR business partners where we look at wellbeing strategies, we design interventions, we design wellbeing programs. And I guess it's that interface between being able to sit with a client who's at the coalface of wellbeing and struggling with their mental health, and then equally sitting with companies in terms of designing and helping build strategies that gives, I think, a clear view in terms of the landscape of well-being going into 2026. And so I think that's a nice position perhaps to share some of my experience and what I see day to day in a conversation like this.
Fantastic. Great to have you here, Simon. And I think that bridge between both being at the coalface, really supporting individuals and working with organizations on their strategy. I'm sure there's a lot for you to share with us today. Thanks for joining us. Great. Hugh.
Hi, Jill. Morning. So I'm Hugh Bennett, Director of Corporate Consulting at Howden Employee Benefits. So we work closely with organisations to help them take that health and wellbeing conversation away from just being a benefits conversation and more focusing on it being as a business risk. My team work with clients using data, claims information, and importantly, culture as well to help them move away from being a reactive employer and one that focuses on prevention as well. And I'm really looking forward today talking about mental health issues in the workplace, what businesses are trying to do to counteract them, what's working, what's not, and how they can turn insight into action.
Fantastic. Great to have you here, Hugh, and share that sort of macro level view. Thanks for joining us. Fantastic. And Ian, last but not least.
Hi, I'm Ian McKenzie. I'm Head of Pension Benefits and Wellbeing at BNP Paribas. I'm focusing on the UK. We have 7 different companies. I actually joined 20 years ago as a pensions professional, and after a while took on some of the benefits, or all the benefits, and then just decided I'm a wellbeing specialist, a mental health specialist, and all the rest. Sort of fake it till you make it type approach. And during that time, I think we've been able to push things, be quite innovative, do things, and I think within the business, they've given us the freedom to go and do things and say things. So even back in the day when we first started talking about mental health, it was quite unusual. We had to have a debate with corporate comms about whether or not we could even use the words mental health. Obviously, you wouldn't have that now, but that was the debate back in the day when we started talking about these things. So yeah, I've been pushing it, and I like to say really what BNP Paribas do is pay me to help people.
Fantastic. It's great to have you here. And I think I remember those days as well of like, oh, taboo subject, let's not even use the phrase. And we've come so far, which I think is a point of celebration and recognizing where we are today. But I know from our conversations in the past, Dean, there's so much that you're doing well and really leading in the market in terms of this. So I'm sure there's a lot of people who'll be interested to see what works and what also hasn't worked for you through the conversation today. So thanks for your generosity in sharing that. Absolutely. So we're going to talk a lot about mental health and work. And we know that good work can be a driver of positive mental health, but also that there is a huge impact that work plays and a degree of risk, as you were saying, on people's mental health. So as we dive into the conversation, we want to open up a poll and hear from you. When you think about mental health at work, what do you see as the factors that impact this the most? So share with us in the poll that's coming on your screen now by scanning the QR code, your views on that. And as you do that, we're going to hear a little bit more from Simon. We at Feel Good and HCA have worked together to review 5 years of data around clinical services and organisational trends in terms of mental health at work. And Simon, you're kindly going to share with us some of the key headlines from your analysis, because I know you got really deep into that. What did you see in the data?
I think over the last 5 years, we've collected data from two main sources. The one is what the occupational health physicians are seeing day to day, and then what we in the therapy team are seeing day to day. And I guess, we've been able to track changes that have happened over the last 5 years. And I think if one looks at the occupational health referrals, upwards of 30% is psychology referrals now coming through to us. So it's the single biggest referral area that the occupational health physicians are seeing, and they're seeing that on a daily basis, and they then get referred into our services in psychology. And so what we see is, as psychologists who are perhaps seeing 6 clients every single day, we're seeing that 70% of the sessions that we're doing are anxiety related. And not all of that is workplace anxiety related, but I think the idea is that, the anxiety, the outcome of stress, and that stress can be workplace stress, but it can also be home stress, it can be health stresses, but it manifests in the workplace because that's where I'm struggling to concentrate, or that's where I'm struggling to manage or regulate my mood in a meeting, and I might be a little bit short or out of character. So, the referrals are coming through in the workplace, and it looks like it's anxiety that is caused by work. But very often it's not necessarily caused by work, but it manifests within the workplace. So, we're actually seeing a decrease, to be honest, in terms of what clients would say it is work-related stress that's causing me to get into therapy. So whether that's high workload or whether that's difficult interaction with a manager, that is actually decreasing. And we're starting to see things like the geopolitical state of the world causing people anxiety. We always see family stress, we see health stresses. Point is, anxiety as an umbrella theme that we work with in therapy is prevalent, and that's sort of 70% of the clients that we work with. So, what does that mean for us as therapists? If I'm seeing 6 clients in a day, 4 of them are going to be anxiety related, right? And with that comes some depression, but anxiety is definitely the main presenting factor and issue that we see day to day as therapists.
That's really interesting to hear about your experience. The headlines we see about anxiety epidemics, you're saying actually in the clinical space that rings true. And there's a number of different factors causing that. And I think that just shines a light on the role of organizations that, yes, there may be some workplace factors that are affecting the anxiety, but also there might not be, but it might be manifesting there, and they have an opportunity to help people get support with that as well. In the cases where work is either creating some of that anxiety or amplifying it, what have you tended to notice in terms of the factors that are contributing most in the workplace?
Well, I think it's that always on, workload is there, and I think that's, maybe it's increased a little bit, but I think we've always been very busy and there's a high workload. But I think it's the hustle, it's the always on culture within organizations that makes it very difficult for people to switch off, very difficult for people to turn off the cortisol tap, so to speak. And that is a major driver, I think, when it comes to people struggling within the workplace. So, I think that always on culture is something that I guess going forward we're going to have to find different and more sort of strategic ways of helping people switch that off.
Yeah.
Do you think then, Simon, that that always on culture, and you mentioned it manifesting at work, but actually the underlying cause might be something different. Do you think that's the case, and that it's not always that it is work that is the problem, but people feel it is because it's where they feel it the most, and it's sort of the tipping point?
Mm. So it manifests in the workplace.
Yeah.
But, if you think of somebody who might have a sick child, for instance, or we're in that position where we might be thinking of a parent with dementia, for instance. These are incredible life stresses that people grapple with and struggle with. And maybe I can kind of keep it together, but when I get to work and the increase in demand and workload is experienced and that stress is put on me, that might be where the bow breaks almost, and it's in the workplace, but it's not necessarily caused by work.
And then that responsibility of care sort of flips to the employer in that situation. If they're, you're an employee is under their care for a third of their day, and if that's where it's manifesting, I think that's what we're seeing from businesses is that they're then left with the responsibility of supporting, and that can be really, really challenging.
Absolutely. And I think this shows there isn't that one factor, there isn't the one contributing factor. You've got to look at the ecosystem around the individual. And as you're saying, Hugh, how that shows up in the workplace, and how does work and the demands and the always on culture and some of the workplace relationships perhaps add to that. And therefore, what is the role of the employer, and the fact that people spend so much time there and have a great opportunity to signpost, provide ease of access to care as well in that sense too. If we look to the results of our poll, thank you all so much for sharing. What we're seeing is this always on culture that Simon's talking to is absolutely coming up in terms of the impact on mental health, and really standing out. And I think we see that, and we all probably experience that as well, but looking across our other factors too in that sense. We also asked this question to our LinkedIn community as well ahead of today's session. And what we saw is that actually workload, so this idea of work demands specifically, which we've known for decades to be a real driver of workplace stress, of increased anxiety coming out top, and with management and always on culture, and pretty close behind as well. So it's about recognizing there are a number of workplace determinants we can tackle. But actually, when we're talking about supporting employees with their mental health, we need to think more broadly about how do we support them, their whole lives, and how they are placed in that. The other aspect of the research, Simon, that I'm interested to hear about is you've shared with me a little bit about the differences demographically in terms of who is accessing support with HCA. Could you share a few themes on that?
The gender discrepancy that we see is still very prominent. So again, in our 6 clients in a day, on average, 4.5 of those would be women that we'd see in that. And I guess, we're doing lots of work within companies in terms of men's mental health and trying to destigmatize therapy, for instance, for men. But it is still very high. And we see that in the statistics that obviously 70% of the clients that we work with are women. And within that, the age group of 30 to 39 years old for women is the most common age group that we see in the therapy space. And I guess there's a number of theories around that, and I suppose the one is, maybe there's sort of young family, but also massive corporate expectations and drive and goal. And somewhere there's a squash between those two, and that's difficult for people to manage. But women also get into therapy quicker. They're far more willing to say, I'm not coping, I need a chat, let me check in, check out quickly, feel that they're thriving again and are able to continue. Whereas men, I think we're still really struggling sometimes to feel comfortable enough to access therapy services. And particularly men are going to wait longer and sometimes
we see that in
a worse space.
In our data. So we know from the GP data, any data I quote is always anonymised. In the GP data, in the private medical data, women access to services more. And then if we go to our absence statistics, our female population have a greater number of incidences of absence, but the average length of those absences is much longer for men, which suggests that women are going and getting the support they need, having a little bit of disruption, whereas the men are waiting and they either cope or they break. And when they break, they need a much longer period to get back.
The data speaks so hugely there, doesn't it? So women are accessing care earlier. They're seeing much better outcomes as a result of that. But actually, when we look at suicide risk being highest, in men between 40 and 49, or as you're saying, Ian, actually the longer absences shows that we're not always getting to everybody who needs it. So it isn't that women need more support, it's that they're more comfortable. There's maybe less stigma around them accessing that support as well. Absolutely. What did you see anything else in terms of different ages and how people like to access support? I know there's a lot of that in the media at the moment.
Well, I think younger, people up to 30 are far more psychologically comfortable, right? And whether that's social media exposure, the schooling system is different. I guess, that age group had parents that are exposed to a lot of the education and awareness training that we're doing in the corporate space. So, they're far more willing to get into therapy, and there's not that same sense of dread almost, and there's not that same sense of shame, unfortunately, that we still see, particularly with men. I'll see an older man in therapy, and that first session is always tricky. A man will sit there and say, I'm not comfortable. This is the first time I'm here. How does this work? Am I broken in some way? So there's still so many layers, like an onion, of shame and sometimes guilt even, that I should be okay. And what's wrong with me that I'm not okay? Whereas the younger generation, they don't feel that. They get into therapy, they work hard, they're enthusiastic, they don't see it as something's wrong with them. They almost see this as an opportunity to grow and some coaching. And so even as therapists, how we work with different age groups is something that we see all the time. Men will sit in therapy and say, "What must I do, Simon? How do I fix this?" Right? And so the idea of talking around emotion, is something that we get to in time, but it's not where we start. Men want solutions. We want to know what I must do to fix it so that I can get out of this awkward space as quickly as possible. And so as therapists, we kind of have to be sensitive and mindful of that. But that's how it manifests. The data, that's how it manifests in our day-to-day lives as therapists in terms of what we're seeing day to day.
Yeah, over the years, we've done various things with wearables to measure like heart rate variability and to produce a report. And sometimes it seems that people, we're a data-driven organisation like lots of organisations, people are comfortable talking about data. So it's really personal data because it's theirs, but they're saying, look, this is what the data is showing. They will say to their colleagues, this is what the data is showing, which is effectively affecting my sleep and whatever. And it's just a way of actually getting them to recognise and talk about it.
Yeah.
And open conversations. It's quite... And that probably is more male than female.
Yeah, we see that play out in the training that we run at Feel Good. We do an awful lot around mental health awareness, helping people develop the skills and behaviours to support each other in the workplace and themselves. And exactly that actually the conversations around how are you feeling, how is work making you feel, feels really difficult for people, but give them a little bit of data or a little bit of a theme, even such as the one Simon's discussing, and actually that just eases them into the conversation. And I think that shows that we're unpicking centuries of stigma and centuries of societal and systemic influences over why this is a really difficult topic for a lot of people. Absolutely. We're talking about a lot of things here, and I think we'll open the Menti again. And I'm interested to hear from everybody in the audience, which of these themes or factors feels most relevant for you in your organisation right now. And we'll keep the interactivity going throughout the rest of the session. We will have time for Q&A towards the end as well, I should mention. So do keep your questions coming in the Q&A box now or towards the end of the session as well. But as we hear from everybody in the audience, Hugh, I'm keen to hear a little bit about your perspective. Simon shared the trends that HCA have seen. How does that hold up when you look across all employers and sort of the lens that you have?
Yeah, I think some of the research we've done globally at Howden supports the narrative we're discussing here. So we've researched thousands of employers and employees, and it's clear that mental health remains in the spotlight for them. From the employee perspective, over half stated they'd sought help for depression, anxiety, or stress in the last year. If you think about that, that's probably multiple people in every team in your business. But employers are responding, and they understand it. I think in our research as well, and you mentioned it earlier, they deemed mental health to be the highest health risk cost in 2026. And we see that play out then in services being provided and actions being taken, as Ian's alluded to. 60% of employers now offer some form of counselling, 64% have introduced an employee assistance program, and over half now offer some kind of virtual therapy as well. But there's still a bit of a paradox, and that stigma piece comes back into play. So 1 in 5 of the employees that responded still said they felt uncomfortable seeking their help. And it's not because they don't know it's there. It's not because they don't understand how to access it. It's that fear of how is this going to be perceived by my colleagues and how is this going to impact my career. And interestingly, that's the the employer and employee lens, the high level detail on that. But looking from an insurer perspective and a claims cost perspective, they see things slightly differently. So the insurers responded to us stating they only had mental health as 7th on their list as being the highest claims cost trend in 2026. As we mentioned, employers saw it as number 1. And I think what we're seeing there is the disparity between insurers who have actually seen the average cost of mental health claim decrease despite incidents nearly doubling since 2024. They have got better at getting people the right treatment at the right time, using triage services, which actually increases that incidence but reduces the overall cost. They don't fear it as much in that sense as they would some of the more physical conditions. But for the employer, they're seeing it on the cold face of higher rates, impacting higher numbers of people, and the operational impact that has on absence and presenteeism, etc. So both viewpoints are valid, but it's telling a slightly different story.
Absolutely.
I'd say, look, as an employer, we could have 20 people who have therapy and 1 person who has cancer with the cancer drugs and so on, and it's going to cost you more for the 1 person with cancer in terms of the private medical spend than it will for the 20 people, but the 20 people are often more disruptive potentially than the 1 person with cancer. And also sometimes with absences, if someone's in an accident, they're injured, they're strapped up or whatever, you can predict when they're going to come back, what their pattern of return is, and you can plan for it. And sometimes mental health can be a little bit less predictable, and it's a bit harder as an employer to plan for it and to support that person.
Absolutely, that unknown cost, and actually how do you factor that into your budget, to your strategy and so on. Absolutely. I think that's really interesting. And I think, whilst it's challenging to hear about the increased numbers of people and how that is rising for employers and for us as a society, there's also positive in that hopefully more people are getting the help. And then, as you say, Hugh, they're getting the right help at the right time. And that is being improved in terms of the service provided. So that's reassuring to hear as well. And I think what you talked about, Hugh, there in terms of the fears that people have around, what does this mean for my career? Yes, there might be confidential services for me to access, but do I really trust them? I think that's something in this era is so important for organizations to take seriously. These are justifiable concerns that people have. And if you're already feeling anxious and you have concerns about that, well, that's going to be a bit of a double down effect there. So I think that just really shines a light on the role of organizations to think about removing barriers to access, increasing trust, thinking about that role modeling as well. And I'm keen that we come into you in a second just to hear about, what you have done, because you've done so much well in that space. But first, I'm keen to share some reflections from our audience today in the Menti in terms of which trends feel closest coming through. So lots coming through here. Hopefully you'll see them on the screen. In terms of gender disparity and that ringing true, I see both with my clients, but also in terms of amongst my peer group as a woman who's just over that 30 to 39 category. I absolutely see that play out. The intensity of world events, absolutely recognising that there's a lot in that geopolitical landscape that will affect people. Workload at the heart of this as well. And I think we can't move away from that. And we can't move away from that message today that there is still a lot of work to be done around how do we design work for mental health and wellbeing? How do we make sure it's good work and we're reducing the risk in the workload and reducing that pressure that we see as well? But also the points around psychological safety here too. So I think given what we're seeing that here and given what we're talking about, Ian, I'd love to hear a little bit more about you about, well, what have you done about this and what's worked for you at BNP?
So it's a long game. You don't make any big differences in 1 year. And it has been over time about trying to remove the stigma. You can't remove the stigma completely because it's obviously societal, and society has moved, which is good because we're part of that. And you can see that in something like someone will say, I have a bad knee. Been bad for a few months now, it's causing me problems, and someone will go, why don't you go and see a specialist? Whereas it's much easier to say that than I have low mood and I'm a bit anxious, and that's a much harder thing for people to say. And also anxiety, if you're anxious, then you're much more anxious about disclosing. It's just a
nice compound effect there, yeah.
But what we find is what we try and do is make the environment safe so that people can disclose if they want to, where it's not affecting their work. And if they need to, because it's affecting their work, again, they feel comfortable that they can do that. And so we've built over years, we talk about mental health a lot. We pull in various programs to make it. And we try and use the data as well to try and work out where we're going to access people. So one of the things that we've done, for example, is anyone can see a therapist without any sort of referral. So we've made it so that you can just book, and we see most people will book online firstly by email, so they don't talk to anybody to get the booking, and then a number of those sessions will just be a one-off session. Actually, you had a discussion, you realize therapy's not right for you, or they think therapy's not right for them, but then they can then go into normal therapy, and it's put through the health insurance. So we have to join it up behind the scenes, which can be quite difficult. We then looked at our health screening, and through health screening, although there was questions in health screening about mental health, the pathways all tended to be physical health. So again, the doctor in health screening could just go, right, I'm going to book you in with one of our therapists. So they're trained to look out for that and do that. We also have some online tools and stuff. They're not used that much, but where they are used, the feedback is really good. We have talks. One of the things we found as well, not just on mental health, but if we invite 4,000 people to a health event, I don't know, 80 people turn up. If you invite 120 people in one department, where the department head is saying, this is important, I'm going to be introducing a session, like you to come along, 100 people turn up. So we get that more engagement. So we have sort of mental health champions or wellbeing specialists who we get in departments to try and give us that department level access, because that can, I don't know, we're all such like an IT person, a trader person, HR. They maybe think, well, we're a bit different from each other. We're all the same underneath, but it's easier to go with people like you. So there's lots of different little things that we try and do. If we're doing a session online, my default is it should be 15 minutes rather than this, because it's always an hour like this. It's always an hour. So it's 15 minutes content, and then we run on. If it needs to be longer, it needs to be longer, but our default should be. And then we can run sessions with questions, and they run for 30, 45, even longer with the questions. But it's much easier if you could stand at the door as people come in the office and say, have you got a spare hour today? They're like, you've got to be joking. But can you get 15 minutes? You can get 15 minutes. So it's trying to work out ways that we can make the services more accessible and then get staff to share their stories. Because actually, you think no one wants to share their story, but when you ask, lots of them want to share their story. They're actually happy to share their story, but they never have the option. And so you do have people say, yeah, I was anxious that my pay was going to be, leveled. My bonus was going to be cut. I wasn't going to get the promotion. I wasn't going to get the project. Everybody would look, and they say, and then that happened. And my big regret is that I didn't disclose earlier. And those type of messages then become really powerful with other staff, more so than external speaker saying something.
It's so true. I think what you've discussed there about the influence of leaders in the business, it came up on the poll earlier, didn't it, that it was management was at sort of 27%, and that every day on culture and workload was slightly higher. But actually, if you think about it, leaders and management can influence that always on culture and that workload. And they can also be so powerful in helping people understand that they're okay to come forward, and that they can be custodians of that culture of acceptance and understanding. I sort of think we probably all do this. If you see an email from your CEO, you all read it, right? Like but one maybe from HR, perhaps not always the case. So if you can find leaders,
sorry, Ian.
Well, I'm just being honest. Yeah, if you can find leaders in the business that are known, respected, and ones that perhaps fit the right demographics as well, so appropriate to the audience you're trying to reach, and have them come forward and share their own journeys, their experience, and say, look, if you're here and working for this business, this is not something you'll be challenged on. Come forward. Here's a reminder of how to do so. I think it's incredibly powerful.
Yeah, I think that's a really lovely phrase you used in terms of they're the custodians of the culture of care, and I think that's such an important thing to actually explicitly talk to leaders about, and it being in their accountability. This isn't a nice to do. This isn't a side of the desk job. This is actually part of what being a leader in this organisation is. And I think Hugh, we do an awful lot of work with a wide range of clients, running programs, workshops, podcasts, panels. And exactly what you're describing, we look for who is going to really speak to people. Who do they identify with? Who isn't the obvious person to be talking about this topic? And let's get them to share quite vulnerably, quite honestly, because it's such a marker in the culture of progress and change. And I think that starts to normalize that and starts to help people think, actually, that's a little bit like me, and it isn't the stereotypical person from HR or, wellbeing ambassador. Actually, it's someone who they see as a high performer, who they thought, this would be impervious to this, and actually get them to tell a really human story, and that can have a huge impact. And I think connecting that with, Ian, what you were talking about, it's around having a strategy around this and sort of thinking about how do we shift the narrative around this as an organization? How do we make sure that we really drive that accessibility, both in terms of how we're having the conversations and normalizing it as an organization? So I love the idea of 15 minutes. Everybody has 15 minutes, even the people who are feeling what we've talked about the workload most, they can absolutely do that, but also ease of access. And I think something really powerful in what you said was around no referrals. And actually the fact that I can speak to someone and I don't have to justify it. I don't have to have that approved. I don't have to have that diagnosed. I don't have to actually talk to anyone other than the Simon who's going to help me in that situation. Absolutely. Simon, what would you recommend to organizations about accessibility?
I think companies would say to me often, how are we doing in terms of our well-being? And I guess an idea that we could think about would be sort of a wellness app, not in the sense of an app on my phone, but if I could gauge, and we take that first idea of, awareness. We do all these, events and well-being events around awareness, and people's awareness of mental health has, I feel in the last 5 years increased incrementally. People understand what anxiety looks like, what depression looks like, imposter syndrome, for instance. We work in a very psychologically mental health aware environment, and that's because of all the work that companies are doing. So, how is the awareness of well-being and mental health within the organization? The next one I would always say is ease of access. And as you're saying, how quickly can somebody identify that I'm struggling and access somebody like me? And the quicker they can access it, the symptoms are not as bad when they see me. Therefore, I need less sessions. So if somebody accesses therapy early, maybe 3 or 4 sessions. But if I see somebody who's already been booked off on long-term sick leave, we're probably looking at 12 to 16 sessions. So the spend is different. The amount of collateral damage for that individual is massive. So how quickly can your employees access services, and can we remove some of those barriers that is linked to accessing service? And how that manifests for me as a therapist is, I see somebody in a really dark place. I say, how long have you felt like this? Maybe 3 or 4 months. But I see on your referral form, you saw the occupational health physician 8 weeks ago, but the person struggled to get into therapy and they got bounced from this person and needed authorization codes. And so that person just gets worse and worse and feels more despondent. And very often for men, they won't follow through with that. They'll have the referral. They would have reached out, maybe made 1 or 2 phone calls, hit a brick wall, and just said, I'm not doing that. I'll fix this myself. So ease of access into services, I think, is a massive one.
Occupational health is really important. It takes a long time to embed in an organisation, as I found with more than one BNP Paribas company. But we, for example, give our occupational health advisor referral rights agreed with the insurer. So if they think someone should go to therapy, they can recommend and notify the insurer, and it's approved. After a while, more sessions will need to be improved, but
that's fine.
They have referral rights.
We see them quickly.
Yeah, so you see them quickly, and they have some insight as to what that person needs, so they can put them to the appropriate person. So, and we do try and free up some dedicated HCA time as well to make sure that we do have people available, so they don't have to wait for a long time to see someone.
Absolutely.
And as a therapist, that makes such a difference in the actual therapy chair in terms of somebody's lived experience when it comes to accessing mental health and getting better quickly. So that's, and then the third one is permission. More and more, and as you say, the idea of senior leaders coming out and saying, it's okay, I have struggled, I've had depression. We did a suicide awareness event a while ago with one of our corporate companies, and a very senior leader said, I've had suicidal attempts in the past. I was that bad. And I think the power of that, when it's somebody that is really at the top of the organization, to have the courage to be able to say, I was suicidal. This is what I did about it. The power in that, and the permission that gives everybody else in the organization to be able to put their hand up and say, I'm also struggling, particularly with men, in terms of removing some of that stigma and the struggles that has. So, the permission piece is always going to be something that I think is a work in progress. But we certainly know that when senior leaders are able to give us permission and to destigmatize mental health, we see a massive surge in terms of and there's a clear correlation when we do a wellbeing event where senior leaders talk about destigmatizing mental health and their personal struggles. We see our numbers for that company in terms of therapy go up massively because people feel that it's okay. So that permission piece, I think, is a massive area.
Yeah, I think if you get that culture right, you get the access right, you get the provider right, you then use the data you get from those providers and continuously test the model. Treat it as a core business risk. Not just a benefits conversation or a benefits program. It has direct impact on productivity and organizational cost. And I think organizations need to manage it with the same discipline as they would any other risk.
Mm-hmm. Absolutely. And I think bringing it into that language and taking that robust approach to it really, really works. And I think listening to everything you're all talking about, if you think about someone in that moment of need, that it feels like it's a huge mountain to even try and access care. There might be barriers. What do they turn to? They turn to TikTok, Instagram, social media, where there's so much misinformation, when actually we know therapeutic services really work and the evidence is behind it. That how do we help make sure that they get access to it as quickly and as easily as possible? And let's not underestimate the impact of leadership role modeling in terms of that, and then removing the barriers as well. It's so interesting thinking about, data and just how that can inform a really robust strategy around mental health. Ian, would love to know a little bit more about what you've done at BNP Paribas with your data, and sometimes maybe if there's any cases where it's told you that you need to take a slightly different approach or something hasn't worked and what you've learned from it.
Yeah, so we've got data from all these sources, from the medical scheme, the GP, absence statistics, occupational health screening. But often the providers are quite poor at turning that into something useful. So what we did is we worked with Howden's quite early on to take this anonymized data, and put it into a presentation, charts and so on to track changes over time. So what we find, for example, is quarterly data can move around quite a lot. It's a bit meaningless to quarterly data, but we can see trends over time. And I mean, when we started this journey, one of the things I said to the business is, I want to increase the number of absences due to mental health. But what I mean is, people feel comfortable putting mental health down rather than other or
Absolutely.
headache or sickness or something. And so we've really used that data to try and push. We do see the trend about male and female. It's a difficult one to address, but it's something we can try and address. We also try and work with the networks, because each network will have a particular demographic, and there may be issues for that demographic that you can tap into, and again, get that higher level of engagement. And tracking like occupational health referrals, this work-related issue is quite interesting, because actually when you do dig below the surface, there is often non-work-related issues that are driving it. And that's important, because if they are so sick that they do need to go onto the group income protection insurance, they put work-related stress, it's going to be declined. The insurer's going to go, stress isn't an illness, and if the employers are causing it, it's not going to be accepted. And so it's really important that you dig around those. So if it does get to that position, which hopefully it won't, then at least they will get the claim accepted. So it's really looking at all these metrics, if there's trends, and then it's harder to try and look at trends in departments as well. So we can see different trends in departments. We found that if I actually share those trends in departments too widely, it's like someone will go, my department's better than yours. Well, it's not quite like that, but if one department is having more mental health absences, we think that's probably because they're a much more open department in that respect. But it looks, what that department doing is making their staff off sick. So we have to be careful what we do with the data. Yeah. But it then helps us know where we need to direct. And I say, when we talk about doing something with a department, then we could sort of sometimes gauge. It's not always easy to get the department level information, because a lot of services, they will not know what department there is. But we try and then, can we target that department with a particular intervention? And we won't necessarily say this department has this issue, but we'll know it behind the scenes, and it might just influence where we direct our resources.
Yeah, absolutely. Data just tells such a fantastic story, particularly if you add that lens that you have in terms of really seeking to understand what it's telling us. And I think, I do an awful lot of work in my consulting work with organizations in terms of, well, what data do they already have? And some might have the type of data you're describing, Ian, and they're able to really get into depth and look at those sort of upward ticks in terms as a positive indicator and thinking about progress, but also what do we need? And other organizations, and there might be some of you joining us today who are smaller and who are like, well, we don't have that data. But actually already there's things in their employee engagement survey, their culture survey, data from performance management and pulse checks that they do with people that give an indication of where those hotspots are. And I think we always forget that there's so much data already alive in an organization. How do you just access it, integrate it, as you're saying, look at trends on a longer term basis and think about, well, what is that actually telling us that's beyond the obvious?
Yeah, a couple of years ago, I sort of realised, I was doing my health screen, HCA, you did a questionnaire last time, I'm thinking, just completely blah, blah, blah. I'm thinking, well, wow, these questions, I really want to know what the answers are for our staff. And the HCA give me like blood pressure and, weight, BMI and all that sort of stuff. But what are these answers to these questions? And so we started like, okay, we need to pull that out. And I was like, well, we don't know how to do that. But of course they can do it. And so we start getting this data back. And actually, over half our staff probably go for a health screen every year, which is really good. And they answer in a neutral way. They're answering truthfully. I think sometimes in an employer survey, they're maybe sending a message. And so actually then we can see things like, I feel confident raising an issue at work about my workload. And then we got another source of tracking. And actually some of that data is quite good, that I do trust my manager. I do feel confident disclosing. I do feel supported. Workload, there's always a bit of, in all the surveys we do, there's a bit of a link between workload and stress. So if workload goes up or down, that score goes up a couple of basis points, or down a couple of basis points, that work-related stress goes up or down a couple of basis points. But yeah, it's trying to think, where is this data? And it's disappointment sometimes that the providers are not as good as presenting it back in a meaningful way. So what does this mean? That's the question. What was it last? What was it a couple of years ago? Is this improvement or is this worsening? It's trying to work that out.
And I think organisations probably struggle with the fact they'll have EAP data, OC health data, medical insurance data, income protection data, and so on and so on and so on, and how they can bring that all together. Because you say the providers, as the market, don't work together to deliver that. So how they can bring that together to try and better understand their business, and that's the challenge.
Yeah.
Absolutely. And I think we're finally at a point where I definitely see it in the market that actually technology is now advancing so much that it's going to enable that and make it easier. But in the short term, I would recommend anyone who's thinking, I want more of our data, go and challenge your providers, challenge them to work together, challenge them to give you the data in a format that is easily integrated to your other sources in that sense. And make sure you and your team have the time, the capacity, the capability to actually integrate that and really understand the story behind it, because there is so much richness in what's out there, and it can really inform strategies beyond there.
Well, and us as therapists, we get together quite often to try and identify themes that are coming up in the therapy space, to be able to feed that back to our clients and say, burnout is high here, or imposter syndrome is high here, or this particular group is really struggling with a very tricky workload at the moment. How do we support that? So, the real-time cold face part of therapy, we're also gathering data and trying to feed that back in terms of helpful ways that clients can sort of use that in a way that can plug some holes or just support and create some scaffolding, if you like, for certain parts of the organization.
Yeah, absolutely. We see that too, and we run lots of training sessions, as I've said, and we're always being asked by our clients, well, what's coming up, like in an anonymous and confidential, let's absolutely protect our participants in your sharing, but what trends do you notice? So it's thinking about where are all the different areas that I can get the insight that I need to inform what our strategy needs to be. And we also find it feel good, and through my other work, we've got a lot of wellbeing and HR leaders who say, yes, but I struggle to connect this for my business leaders. They're still not as interested as I would like them to be. And I think, what you're talking about here in terms of, treat this like any other risk, present it in that way, use the data in that way, join the dots between mental health and performance to a greater extent, will allow you to use this data to actually have a very different conversation around that executive boardroom table and actually get this sort of on their agenda as well. Absolutely. We have lots more that I know the four of us could talk about, but I'm very conscious that we've got some questions coming in. And we wanted to take a bit of a look to hear, what it is you would like to hear from my guests today. So please do add them into the Q&A box or chat, and we'll get through as many as we can as we go throughout the conversation. We hope to answer lots Okay. So we've touched upon this slightly, but it'd be great to go back to it. So we'll come to you, Simon, with this one. But the question is, to what extent are young people accessing support more because they are less resilient than previous generations? Great question to kick
I
off.
don't think young people are less resilient. I think young people are more educated. I think they're more aware. Somebody that I work with now in their early 20s has a vocabulary of mental health that I guess psychologists would have had 30 years ago. Right? So their access to information, their awareness is massive. And so, I don't think it's a lack of resiliency. I think it's a willingness to get help quickly because they're not fearful of it. And it's something that they've grown up with and are far more comfortable with. So I don't think the younger generation struggles with resiliency at all. I think they have it there. I think they just are more willing and more comfortable in a therapy space and so access the services quickly.
Yeah, I would absolutely agree with that in terms of what we see in our practice as well. That if I compare running sessions around mental health with apprentices or graduates or sort of early careers versus senior leaders, the difference in terms of the literacy around it, their comfort in overcoming that stigma is there. And actually people are confusing that and saying, was that they need more support? And actually they're just not developing resilience the way that we did. And I would say at least once a quarter, I have a senior leader say to me in a session or in a one-on-one session, yes, but workplace stress is good because it needs to drive that resilience. Now, they're fewer and far between those conversations, thankfully, than they were a decade ago. But it's about recognizing, actually, no, that is absolutely not how resilience is developed. It's developed in the ways that you're describing, learning to understand your own psychological patterns, learning what your coping mechanisms are. And I think that newer generations are great for that it is being normalized. It's taught in school from an earlier age. So they have maybe a little bit more in their resilience toolkit, but then of course it's showing up in a different way than older generations are perhaps used to because we've had decades of stigmatization to live through.
Yeah, I'd quite like to ban the word stress because it means so many different things to so
Absolutely.
many different people. But yeah, we see that when I started work a long time ago, mental health in the workplace wasn't a thing. I probably wasn't very mentally well when I started work, but I had no concept. I was only by looking back. Whereas now, my kids are now early 20s, but they would come home from school and say, what did you do today? Oh, we had life skills. It was boring. What did you do? Oh, we did resilience and mindfulness. What did you talk about? And it's like, well, they're having these conversations in school. I can't get much out of them as to what it was covering, but they're having those that just wouldn't have existed in my generation.
And if I see in some of our clients, particularly, if I think about our clients in the city, that when we're running these sessions around mental health and how to look after yourself in the workplace and how to support colleagues and have conversations, what we're seeing is the equivalent of your children in their early 20s starting their career. They're showing behaviors to their line managers that the managers don't feel equipped to deal with because they haven't had it. So they've learned that in school, they've learned it throughout their life. And that's why it's so important, as we talk about leaders role modeling, but also developing this skill and the capability in your management populations and your senior leaders to know what to do with that. And that you don't need to be their equivalent of a Simon and a therapist, but instead, how do you create a psychologically safe environment to listen and to signpost what access to care that they have? So that's where manager training skills can be so important. And guarantee at every session we run with slightly older demographic in the workplace, that comes up. I don't know what to do about this. I'm worried that they're going to bring up something that I don't know how to deal with. And it's about how do you help people feel confident dealing with the newer generations and what they're bringing to the conversation. Absolutely.
Well, and the younger generation will often say, I like that company because they have a mental health or well-being strategy that resonates with me. They have ease of access into therapy, and that's important to me. And so if I have a choice between this company and this company, sometimes, their well-being strategy and what they offer their staff in terms of structured support is the deciding factor for younger people. So, and sometimes over salary, the benefits that I get in terms of well-being outweigh salary for some people in the younger generation. So I don't think it's around resiliency. I think it's just a different way of thinking about mental health and well-being.
Absolutely. And I think the empirical evidence would back that up as well. And I think it's important to think about, what you're describing there, not just as a benefit, but actually as a business enabler, a performance enabler. That is important from talent attraction point of view. That's going to bring in new talent, but ultimately it's setting them up to do a much better job as well. So there's so much in terms of what it unlocks in terms of performance too. Absolutely. Hugh, I think you had something to add there as well earlier.
Well, I was only going to say actually from what you mentioned there, that our data that I've seen supports that in that I think Gen Z are probably going to represent over 30% of the workforce this year. And I think it's around half of those surveyed so they would change employer for a better well-being benefits program. So you're right, that importance of having those things in place for attracting future talent. Now, they're going to be the future of the workforce. An interesting point for you, Simon, on that is that you've mentioned that, I'll say Gen Z, but future generations are get better at getting access quicker. Do you feel then that this is a problem that will reduce over time as older generations step away from the workplace?
I think mental health will improve,
yeah,
but I think access and the number of clients that we work with will stay the same or get higher.
So it's that higher incidence, reduced cost again.
And I think people are increasingly thinking of proactive therapy rather than reactive therapy. So I'm seeing somebody who says, Simon, my partner's pregnant. I know it's going to be a tough time. I'd like to put some strategies in place to be able to support my mental health so that I can do both. That's not therapy that we saw 5 years ago, where somebody came in and said, I've got a young family, I'm not coping. We're seeing a very different mindset now where people feel okay to access therapy, not because I'm broken in any way, but I don't want to become broken. And I think, that for me as a therapist, my heart sings when somebody sits there and, is looking into the future and being proactive rather than reactive, and if companies can offer that in their well-being strategies and their benefits, who wouldn't want to work in that organization where I don't have to be broken first, but I can layer my resiliency, for instance, into the future.
Yeah, I think that's an advantage of where we say you can speak to a therapist without any sort of referral. So if you're not sure, you can speak to a therapist, right? You can have a one-off session. If you lost an hour, so try and just make it easy and accessible.
Yeah, absolutely. And I think that can be extrapolated out, that my heart sings as well, Simon, when I hear that, people, being proactive, preventative, and that's both at an individual basis, but also extrapolate that as an organization. A lot of my consulting clients are like, okay, we've got some fires to fight. We've got hotspots of work demands, of relational issues, of people needing support. We need to fix that and we need to help them. But also, how can you do that in tandem with not losing sight of the preventative piece? How do we really look at our workplace strategies, our OD strategies to think about, are we preventing risk for the future as well? And now that, I know there's a lot of people joining us today who'll be in small teams and think, well, how do we do that? But it's about really being clear on what the priorities are for both. So you are not just, really putting a plaster over things, but you're actually thinking about what's our preventative strategies as an organization. And back to your points about data as well. Absolutely. Yeah. So we've got some other questions coming in. There is a question around ensuring that global mental health approaches remains consistent and culturally relevant. I know, Ian, you predominantly focus on the UK workforce at the moment.
Well, I would comment that because we have a global We Care programme that works for common aims across the world in different countries. Now, if I was prescribed to a global template, we could do less because things are probably different. I don't know if the word's advanced, but in the UK, we have more scope to do things. So therefore, we're empowered by the business to do that. But we also recognise that we're what we call a matrix organisation. So people work on national lines, but they also work on business lines across the globe. And so you can be in the UK, but your manager's overseas, or your reports are overseas, or both. So it is difficult because the cultural aspects is different. So I think as well as having something global, you also have to have empowerment at local level as well.
Absolutely.
I would just add to that. I'd say that I'd approach this in the same advice I'd give for benefits as I would for health and well-being, is make sure your partners, your advisors, and then your provider partners have both the global reach and people on the ground in the territories, but then the deep local expertise as well to be able to understand to that point what is culturally relevant there and how when we talk about benefit equity globally, that doesn't mean everyone getting the same. It means everyone getting what is equal in that territory or deemed equitable in that territory.
Absolutely. And I think that's such an important point. You've got to really understand the local culture, how they work, how they behave as a society for that equity to be there. Yeah. And I think what I see a lot, I work a lot with global clients, is there's always a risk coming from here in the UK or the US that we're trying to adapt a Western-centric approach and make it fit within that culture. And that's not the solution. That isn't equity. Instead, it's about understanding, well, what are the cultural norms and how do we make sure that people can have access to what they need? I was on a call with a senior leader in China just before this session, and that's part of the conversation we were having. This isn't about actually people saying, I need help to my boss. That is not going to happen. Absolutely not. So what does ease of access look like? What are the alternative routes? And you cannot do that without working with people who are living, working, breathing in that culture in that sense, and just really watching out for the trying to have other cultures adapt to a Western-centric approach would be my advice to organizations as well. So have that global network. Definitely. Absolutely. Okay, the juicy question. I am not surprised to see this one come in. Has access to AI had an impact on mental health? Simon, I'm going to come to you first.
Yeah, I thought we would get this one.
So did I.
Well, I guess there's two things that I'd maybe touch on quickly. The one is AI in terms of people's knowledge, people's access to knowledge, the ease with which we can get information about mental health and obviously everything else. Is that changing how people access us? And I think, if you're struggling with something and you use an AI and it gives you some advice, or, people struggle sometimes to process that information. So as much as, we have this increase in terms of information, I think as a therapist, that person will bring that information to me, and in the therapy chair, we can help process that. We can help contextualize that. And so that information doesn't become overwhelming and increase one's distress. Processing that with a therapist in the therapy chair is the first prize. And I think, that combination of access to good information and a space to process that is where I think the AI is helping therapy. I guess as a therapist, there's another aspect to that, for the first time clients will say to us, I'm going to record this session, transcribe it, and my AI is going to break it into bite-sized chunks, right? We also have clients who in the middle of therapy are asking the AI questions and then not trying to catch us per se, but will challenge us with things that they are kind of asking, their AI platform. So, the landscape in terms of AI is definitely changing. And I guess people say to us, as therapists, are you going to be replaced? And maybe that's something we all are a little bit anxious about. And I don't think so, because I think therapy is a space where we're able to process large amounts of information to help people contextualize that. And they come out with, I think, a fuller extent of information and mental health, because they've had information and they've been able to have a safe space to be able to process what they've read or what they think. So that combination, I don't see them as fighting or opposing each other. I think, it can be used very positively.
I think that's great to think about them being complementary in that sense, but also the importance of that human-to-human connection. I think there's some early pieces of evidence that are showing it is that safe space, that having another human being listen and validate and make you feel seen for what you're experiencing, as well as all the great help you would give me, Simon. It's that connection that even on a physiological and a deeper psychological level goes beyond what I can offer. But I love that really modern approach in terms of how do you integrate it as well in that sense.
Because it's not going away. Right?
No,
if anything, it's increasing.
If you think about it in the workplace as well, it essentially, if utilised properly, allows employees to do more, or it should make their life easier. But with that, then comes a question of, does that equate to more time and free time that we would hope, or does it equate to the ask being greater?
Exactly.
And that's going to be an interesting one, see how that pans out.
Absolutely. And I think I would encourage absolutely anybody who's thinking about AI and what that looks like in terms of workplace efficiency to actually have a robust strategy around this and actually stop as an organization and think not just how do our employees pick up whatever AI tool that they want, to think about how do I, shave a little bit of time off here and there, but how do they really set up the right technology and processes to improve how people work? But simultaneously, as part of that strategy, how do they reduce fears and the fact that there's a lot of people feeling a lot of insecurity around, is AI going to take my job? And I think it's about how do they really make this thought through and make sure that the ask doesn't become so much bigger that we end up in this cycle where the demands are still quite so high and actually people don't feel set up to cope with them in that sense. But definitely feels like we're at the sort of, the beginning of the next era in terms of what AI could do, both positively if it's harnessed well and used well in that sense. So we have lots more questions left, but I think I'm conscious of our time and making sure that everyone has some time and space if you're joining us at lunchtime to go and take a break as well. So we'd like to just sort of think about our final reflections. So I'd love to hear just something from each of you, just about one thing that you would like everyone who's joined us today to walk away with. And as you share that, we're keen to ask all of you to join us on the Menti again and share a little bit around what's the one thing you're going to put into practice, or one key takeaway that you've taken from this conversation? So as our audience are sharing, Simon, I'll come to you. What's your final comment?
Yeah, I think well-being in 2026 is going to be less about support because we have those structures in place. And I think it's more about recovery by design. So ways of working that build in recovery so that we can switch that always on culture off for a little bit. High performing teams can't play international matches week in and week out. We need breaks. We need to be able to give people permission. I think our senior leaders giving people permission. And I guess that's going to be the next step. How do we design workplace to be able to give people permission, even when people don't want that permission, right? High achievers, I don't want to switch off, right? But we also look at long-term resiliency and productivity. And ultimately, clients are going to make more money if we have people who are able to perform at the highest level and then decompress and repeat.
Absolutely. Great. Thank you. Hugh, how about for you? A final comment?
Yes, I think I'd start with actually a question or a challenge to the audience and organizations in general, that if someone in your organization was struggling tomorrow, would they know where to turn and would they feel comfortable and safe in doing so? So that's something to take away. And then in terms of action, I think I'll come back to that. Equipping your managers and leaders with the right tools to be those custodians of the culture, a culture of acceptance and accessibility, because by the time someone reaches therapy or prevention, by the time someone reaches therapy, prevention has already failed.
Absolutely. Great. Thank you. And Ian, from you.
It's just probably reflect that people internally lead messy and complex lives in their interactions with people at work, messy and complex, sometimes at work, messy and complex, sometimes less so. And behaviour change in lots of areas of work is really difficult. And it's somewhat arrogant to say that we can, as an employer, make all these differences to people's mental health. But actually, with hard work over time, you can definitely make a difference, and you get that both appreciation and personal note when people are saying, oh my God, this really helped me, as well as organisationally, I think, a healthier, more productive workforce.
Fantastic. All three very positive messages to end on. So thank you all so much for your time and your insight. I feel we could have talked for hours longer. But I think, we really have heard how mental health remains an organisational priority for 2026. We're hearing a lot about the progress, but the fact that organisations are really well positioned to make that difference, as Ian is saying. So we encourage everyone to think about, accessibility, removing barriers to access, really using your data to understand where you're best placed to help, and thinking about, planning for that recovery, designing for it and designing for good work by really working on the systemic and the workplace elements that support good mental health. So thank you so much for joining us and for joining in the conversation as well. We do want to hear from you on LinkedIn, so reach out, connect with any of us, but also share your reflections on what you've taken from today's session. Thank you, and we hope to see you again in the future.